Next we're going to look at supine physiological assessment, physiological motion assessment. So first we're going to look at the OA joint, which is your nodding joint. It mostly just does flexion and extension. So with flexion, it has an anterior roll and a posterior glide at that joint, and then with extension it's the opposite. So what I'm going to do is I'm going to cup the patient's occiput. We'll bring him up into that chin tuck, full cervical flexion position and assess bilaterally. If you want to check unilaterally, you can impart just a little bit of lateral flexion, very, very slight, and just feel the difference, right versus left. Then I'm going to be right on that, just under that occiput, and induce that chin poke, upper cervical extension, and assess there. For the atlanoaxial joint, what we're going to do is we're going to check rotation, because that does about 45 degrees of your total cervical rotation. So I'm going to bring the patient up into full cervical flexion, and you can kind of use your stomach to help guide this a little if you need to. And then you're going to rotate, checking one side versus the other, if there's a difference, if there's pain, or if there's significantly less than 45 degrees of motion. Okay. Then bring it back down. Then we're going to look at upglides of the cervical spine. So if we are looking at the left side and we're checking that upglide motions are flexion, and then opposite side, side bending and rotation. And then downglides are extension, same side, side bending and rotation. What I'm going to do is feel with my left hand. That's going to be kind of guiding the skull, so I'm going to put it right on the occiput. My right hand is going to be what's feeling for the motion down to the targeted segment. So if I'm going to start on C3, I'm going to put my fingertip right on the edge of that C3 articular pillar. And what I'm going to do is I'm going to impart a little bit of flexion. And then I'm going to, first I'm just going to check right rotation. I'm looking at this left side. Okay, so I know what that looks like. Then I'm going to do a little bit of flexion, side bend to the right until I feel that motion kind of lock out on the right side, and then rotate to the right. You can compare switching your hands. Get on the other side, feel on the left. I'm going to induce that flexion, side bend, and then rotate to the left. As you move down, so if we go to C5, feel down that articular pillar to the right C5. You're going to flex up, side bend to that segment. You're going to have a bit more motion, and then rotate. Do the same thing on the left, C5 articular pillar, flex up, side bend, and then rotate. And then finally, you can work your way all the way down to C7, getting your finger on the side of that articular pillar, flex up, side bend away, maintaining that flexion. Might have to kind of fine tune it a little bit, and then rotate to the right. Same thing on the left, getting along C7, flex up, left side bend, and left rotate. So that's upglides. Your downglides are the exact opposite. You're going to be checking same side, side bending, rotation, and extension. So if I'm going to again cup with my left hand, put my right on the right articular pillar of C3, and I'm going to side bend to the right, rotate to the right, and impart just a little bit of extension. And you can compare that to the left side. Getting down on that C3 articular pillar, side bend left, rotate left, slight extension. And you work your way down to C5, feel down, C4, C5. Use your other hand to guide, side bend to the right, rotate to the right, and extend. Thing on the left, side bend to the left, rotate to the left, and extend to that segment. We'll work our way down to C7, and you'll have a lot more side bend to get that full motion. Rotate to the right, and impart slight extension. C7, left, side bend, rotate left, and extend up to that segment. Next, we're going to look at some occipital nerve assessment. So what I'm going to do here is I'm going to cup around the occiput, impart that full cervical flexion, chin tuck, and then I'm going to do the opposite side lateral flexion. So if I'm testing this left side, I'm going to go to the right. That in and of itself won't tell us much, but then if I then ask my patient to bend your knees and assess for any change in the pain with that versus leg straight. So then the same thing, full chin tuck, slight lateral flexion, testing this right side. I'm going to have you bend your knees. Good, and then bring it back and assess for a difference in pain. Finally, I'm going to have the patient sit up at the edge, and we're going to test trigeminal nerve. So what I'm going to do is I'm going to get a grasp on the jaw, because at the end we're going to provide a lateral glide at the mandible. So what I'm going to do is I'm going to bring him into full cervical flexion, and then opposite side lateral flexion, and then I'm going to impart just a slight lateral glide at the jaw. If that's really irritating, you can also have your patient just open and close their mouth. Okay, then I'm going to do the opposite. Grasp around here. We're going to do full cervical flexion, lateral flexion, and then lateral glide.